we all know that a multidisciplinary team includes the patient. I'm sure you've all heard and thought about many times this idea of patient-centered care. Of course, everything that you're doing in your own practice, everything you're thinking about in your professional life is about the patient. But I think I really want to broaden this definition that it's not just about including the patient, but it's also about including the whole patient, right? Because all of you are so focused on your one discipline, on your one disease area, on your one medication, on your specialty in our incredibly fragmented system that's been able to go really, really deep and make a lot of advancements, which is wonderful. But also I think in that there's kind of this loss of seeing the patient as a whole. And I just think that if we're talking about fertility, we're talking about a very sensitive issue that isn't just affecting, it's not just a biological issue. It's an issue that affects a person, a life, goals, dreams, fears. And so especially if patients are being diagnosed younger and younger, it's like, how do we help patients to feel equipped to handle this, huge life milestone if they so choose? And I think that's the other thing. So I kind of come at it as an integrative wellness educator from this perspective of integrative medicine, which is really about taking the best of conventional medicine and, different modalities that expand beyond that in order to support the patient holistically and not only look at the illness, but also illness prevention, lifestyle, and that really important emphasis on the therapeutic partnership between the doctor or the healthcare practitioner and the patient. It's kind of so the word patient comes from the Latin, which means passive. And so as patients, living with childhood cancer, being at sick kids for 3 years from 7 to 10, and then being diagnosed with colitis at 17, it's like so much of my childhood and adolescence and early 20s was in this role as passive. And so even the idea of having a child, it's still honestly at 35 feels really beyond my reach almost psychologically, in addition to the physical complications, because I felt like I was in such a passive victim role. And so I think the last 15 years for me have been about, okay, wait, how do I reclaim my agency and my sovereignty over my body and start to redefine what it means to be a person beyond a patient? So anxiety and depression are hugely correlated with IBD. I think we all know this, but I just think it's worth mentioning because, again, this is going to affect every area of a patient's life if they are dealing with this. And so how do we help our patients to manage these symptoms so that they can start to self-regulate and they can start to actually think beyond their disease and really, a lot of the anxiety and the suffering. Oh, and also women with IBD are more likely to have symptoms of anxiety and depression than men. So this is important for us. How do we support our girl patients, women patients, male patients, so that they can manage those symptoms? Because of course that's going to affect their quality of life and it's going to affect their fertility journey immensely. And so I loved this quote from Dr. Roseanne Scheinberg, who is an oncology surgeon in the States at Johns Hopkins. As a medical system, we need to pay attention to the things that elevate our health and consider all the factors that influence health, wellness, and disease, including body, mind, and spirit. We do so much body preparation, and I know in this conference, the rest of the conference are going to get really specific, which is wonderful, but we don't address what's going on in a patient's head, their worries, their anxieties, their rumination, and we don't help them deal with any of that in a structured way. Stress reduction is one of the most underutilized areas of medicine. This is important if we want to think about the quality of life of a patient and if we want to think about fertility. It's not just about, every time I think about the idea of having a child, it's not just about the physical effects, right? It's about I've been in so much chronic physical pain my whole life. Am I actually going to be equipped to handle this? Am I going to feel alone? Am I going to call the doctor and they're not going to answer? Of course not, because now my doctor is Dr. Wang, but in the past, So it's like, am I alone in this, or do I actually have the resources and tools to feel equipped? Because all of my friends and family now that are having kids, it's not easy. We all know that. So it's especially not easy if you're also dealing with a chronic illness. And, my partner doesn't really understand. He's lovely and so supportive, but I don't think he understands the amount of fear that I have because of what I've been through. Quite frankly, a lot of PTSD that I've experienced just being a patient for that long that I've really have to work through as well. And I had a naturopath once tell me, because so much of my suffering, which is distinct from pain, was around I'm not meeting these milestones. I'm not accomplishing these goals in my career, in my love life, because I have such crippling shame and anxiety and fear of my body and all of these, really difficult emotional things that I'm working through. And she said to me, you're not going to necessarily reach your milestones at the same time as everyone else. And that's okay. And her telling me that was such a weight off of my shoulders. So I think as doctors, sometimes maybe you're like, okay, we need to talk about fertility and we need to make sure that, I remember I was getting surgery, I was getting my total colectomy, and the surgeon was like, okay, well, you better get pregnant in the next 2 years or time's run out. And it's like, okay, well, no one asked me if I want to get pregnant or if I'm ready to get pregnant or if I have a partner, you know what I mean? So it's asking, part of that therapeutic relationship is asking the patient what they want and helping them come to terms with that, which of course you don't have time for, but that's why you have other resources to help manage that burden. So that's where I come in. That's where so many different practitioners come in that help with this stress reduction and help with this self-regulation in order to make patients feel empowered in their own care. Because I can't think of anything more that requires more power than being a mother. So let's prepare our, patients to, if they so choose, walk that path. So through mindfulness, through yoga, through breath work, these are all really, really powerful tools that have a lot of research behind them at this point that can help manage this whole journey. And ultimately, I think we have such a deficiency-based model, and one of the things that happens when you're a patient is that you go to the doctor and you tell them what's wrong with you, and then you go to a therapist and you tell them what's wrong with you, and then you go to a specialist and you tell them what's wrong with you, and then you think about what's wrong with you, and then you think about how you're different. And I think that what we, hopefully within this integrative model, what we can start to think of is, okay, how do we actually move people into this post-traumatic growth, which is real. But it's not gonna happen if we avoid the reality of this disease or whatever our challenges are in life. We have to process them, we have to grieve them. And then we can, once we really accept where we're at in life, once I finally at 33 was like, okay, I have this illness, no matter how much goji berries I eat, I'm still gonna have this illness. Even if I'm a yoga teacher, you know what I mean? I had to kind of come to terms with what was actually happening, with the effects of the surgeries, with my reality of what it means to be in this body and have gone through what I've gone through, just like any other patient or any other person. We all have our own unique struggles. Once we accept that, then we're not denying deep distress, but this adversity can unintentionally yield changes in understanding ourselves, others, and the whole and the world. And this can happen in interpersonal relationships, new possibilities, personal strength, spiritual change, and appreciation of life. And so I know that that's happened for myself through years of work, and I know that that is possible, and I just want to keep that in mind so that we can not just think about managing symptoms, but helping our patients redefine their own meaning for themselves so that they can make meaning out of their illness so that they can really move forward in an empowered way. Thank you so much, and stay in touch.